Hi, Dr. Ariane from the Movement Paradigm. We've been talking all week about hip mobility, so I wanted to talk about the pelvic floor's role in our hip mobility and function. So today we're going to cover some functional anatomy, we're going to cover some of the root causes of poor hip mobility, and of course how the pelvic floor can influence this. Now, to speak about the intrinsic stabilizers of the core, I think is really foundational. So when we're looking at the pelvis, we want to think about the top of this, the top of our intrinsic unit of our core is the diaphragm. The bottom is the pelvic floor, which you can see here. So these two things have to work together in this very fluid, rhythmical fashion for everything to sequence and coordinate and have the right timing. So that is essentially what we refer to as motor control. So once again, so at the bottom of the pelvis, we have the pelvic floor. The pelvic floor is actually feeding into the deep hip stabilizers. This is what actually keeps the hip in its socket. Think of it as a suction cup, similar to the rotator cuff. So this integration actually comes up and then integrates with our hip flexor, our deep psoas. Our psoas is also a deep stabilizer that is preventing the hip from shifting forward. So very, very important. Also is integrating the pelvic floor integrates with the transverse abdominis. Think of that as our natural weight belt. So if we take an inhale, exhale, pull our belly button in tight, that's where that transverse abdominis is very, very active. And then that ultimately fascially attaches to our diaphragm. So you can see this really, really deep fascial integration of all of these deep stabilizers that have to work reflexively. They have to work automatically. And when this doesn't happen, that is where we really begin to see pain and injury and mobility issues, because the body will start to find stiffness where it needs it. It will start to create stiffness if there is a lack of stability. So as we're thinking of hip mobility, we want to really think about how is the hip stabilizing? How is the deep core stabilizing? To take it one step further, what you can do as I am going through this visualization is try this exercise. So as you take an inhale through the nose, the tongue resting at the roof of your mouth, touching the back of your teeth, inhaling, and as the pressure in the abdomen goes down, the pressure is building, 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 going all the way down to the base of the pelvis. That is when our pelvic floor will be in a lengthened position. Okay, so then as we exhale, your diaphragm is going to go back to the resting position. The pelvic floor is gently contracting and lifting, and then that pressure is decreasing. Of course, diaphragm goes back up. Our abdominals are contracting to create that corset, and thereby we have a full diaphragmatic breath. So this diaphragmatic breathing, integrating with the pelvis, is very, very critical to having optimal hip function. So why might you have tight hips? Of course, there are several reasons, but one of which is the most common is going to be increased sitting. This is going to decrease joint mobility, decrease the elasticity in your muscle and your fascia. So that can, of course, create ongoing stiffness. But some other things that you might not think of are, one is poor breathing. So if we are not diaphragmatic breathing, as I just mentioned, with that proper sequencing and coordination, that can cause tight hips. Secondly, or the next thing would be our pelvic floor tightness. So when we think about squeezing or clenching the pelvic floor, this is where we tend to hold a lot of emotions. Of course, the next thing is stress. So a lot of times, because we hold our emotions here, stress is a really big driver of tight, hips and pelvic mobility. So definitely something to address. And then lastly is poor hip stability. So although we're thinking of motion, if things aren't sequencing properly from that stabilization perspective, then you can't extend through the hip. You can't use your glutes like you want that you should be able to. So this can lead to tightness and compensation. Your body will always figure out the path of least resistance. So if you don't have stability somewhere, it will find stability by tightening things up. So one of the simplest ways to begin to address this is to begin to work on your breath. You can do this lying down with your knees bent. It's a great starting point. Stacking your rib cage over your pelvis, really important, because again, we looked at that pelvic model. We want the It's the rib cage stacked right over top so the diaphragm can communicate effectively with the pelvic floor. And through this, we are thinking of inhaling, breathing 360 degrees of pressure into the abdomen. Exhaling, contracting the abdomen, think of it like a corset or weight belt. As you're inhaling, you're breathing all the way to the base of the pelvis so that the pelvic floor can relax, equally as important as actually contracting the pelvic floor, sometimes more important. And then really begin to get this coordination down and integrating this into everything that you do. All of your day-to-day activities, your exercise, of course, really beginning to adopt this breathing pattern as your normal, healthy breathing pattern, which is exactly what it is. We breathe 25,000 times a day, so this is really how you want to think about breathing. All right, so I hope this was helpful and this can help you improve your hip function, your hip mobility, your core function, and at least give you a new perspective on why you might have tight hips. If it was helpful, definitely give it a like, give it a share to a friend or family member, of course, and make sure you subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement. Bye.